Though a blissful and a magical stage in every woman's life, motherhood is subjected to many stressful situations.
Every new mom is vulnerable to certain stress called baby blues or postpartum blues, a psychological condition normal for all the new moms. When it slips from you, it can lead to the postpartum depression and psychosis, which requires medical attention.
Hi, my name is Gazal Roopchandani and I am a clinical Ayurvedic dietitian and a holistic nutritionist. So today we will going to discuss about postpartum depression management in Ayurveda. Are you one among those who suffer from postpartum depression?
Then stop taking the health depressing antidepressants and mend your mind with the time tested holistic science Ayurveda. With the first pregnancy, many women feel excited about the upcoming baby and worried and anxious about giving birth and caring for the baby.
85% of women exhibit at least some kind of degree of mental disturbance. Such disturbance that occur within the first week after delivery are called baby blues, postpartum blues or maternity blues. This condition, is not very dangerous. After 2 or 3 weeks, the mother will return to the normal state of mind. But when it is prolonged or uncontrolled, it can lead to the severe depression.
Postpartum depression is a complex mix of physical, emotional, and behavioral changes in some women following delivery.
Usually, begins within 4 weeks post delivery, and when it is prolonged, it may further lead to, postpartum psychosis. Symptoms of postpartum depression are usually hard to detect. Many women might have these symptoms following childbirth, such as
Trouble sleeping, appetite change, severe fatigue, frequent mood changes.
in postpartum depression, women also suffer from the other major symptoms of depression, which are not typical after the childbirth and which may also include
Lacking attention towards your baby, getting angry, reluctant to breastfeed, crying or laughing all the time for no reason, depressed mood and severe anger and crankiness, loss of pleasure, reluctant to eat or drink or sometimes overeating, visuals and auditory hallucinations, death and suicidal thoughts, trouble concentrating.
there is a wide of causes of this condition ranging from
Hormonal imbalance to anxieties about one's body shape and beauty. There is a rapid drop in hormones post delivery.
connection between this rapid drop and the depression is still not clear, but what is known is that
The levels of estrogen and progesterone increases tenfold during pregnancy and then they drop sharply post delivery.
in addition, the social and the psychological changes of having a baby creates an increased risk of depression. Some factors that increase the chances of postpartum depression may include prior history of depression before or after the pregnancy, age at the same time of the pregnancy. The younger you are, the higher the chances. Suffering from highly stressful events like job loss or health crisis, having a baby with health issues. It may also include like family history of mood disorders, previous health history of depression, or premenstrual dysphoric disorder, living alone or limited social support, material conflict. As there are worries from the very beginning of pregnancy, prepare your mind to be happy and ready for the fact that you are going to be a mother. There should be the full support of husband and family. And the feeling of having support of husband and family gives strength to the mother. Garbhani Parichaya and Sutika Parichaya, which is also mentioned in the Ayurvedic classics, can be followed to prevent those postpartum maladies. But the specific treatment is necessary for conditions like postpartum depression and psychosis. Dhi Dhairya Atmati Vigyanam. A good counseling for the mental disorders first can be given to the mother and then family. It is prescribed to administer the suitable medicines like ghritam, ghee, and other medicines according to the condition. Some of the Ayurvedic treatment procedures to treat the postpartum depression may include
Abhangya, with medicated herbal as bal tel and pind tel etc. helps improve muscle tone and enhances the body complexion. It also helps in relaxing the mind. Vetukuli or bathing in medicated water for 9 to 40 days helps regain the lost physical and mental strength and replenishes the body tissues. Music therapy is a good remedy for the mental health. This is something that many studies have proven. Mohanam, Hum Sadhvani and Thodi are songs that evoke happiness. Listen to ragas like Nilambari if you are sleep deprived. Both mother and baby will benefit equally. Takradhara is a cooling and a relaxing treatment procedure where medicated curd is poured over your head in a steady motion and help you regain mental stability. Dasyam, the process of instilling medicated liquid into the nose, can cross the blood-brain barrier and mend your psychological issues.
Besides these procedures, there are several other treatment procedures according to the patient's condition. A healthy lifestyle is necessary for every aspect of your life. To cope up with postpartum depression, certain lifestyle modifications are to be followed, such as
walk with your baby to stay active, eat healthy, spend time with your family, take adequate rest, avoid alcohol and prepare yourself.
Studies have also shown the link between the nutritional deficiencies and postpartum depression. The nutritional deficiencies that can potentially impact the postpartum depression, which may include
omega-3 and omega-6 essential fatty acids, folate and trace minerals such as iron, zinc, selenium and potassium.
Many new mothers suffer from the serotonin levels, the feel-good hormone and the norepinephrine levels in brain, which gets exacerbated by the nutritional deficiency.
The brain needs a continuous supply of nutrients including tryptophan and vitamin B6 to produce sufficient serotonin and other neurotransmitters. Foods that are recommended to the woman: cottage cheese, bananas, spinach, pineapple, moon beans, lentils, asparagus, sunflower seeds, flaxseed oil, walnut, peanut, salmon, sardines and tuna. Yoga renders mental and physical well-being. Practicing pranayam, anulom vilom or nostril breathing and bhastrikriya can help balance vata, which is the main culprit of postpartum depression according to Ayurveda. Among the yoga asanas, Bhujang asana, Uddiyana bandhasana, Pavan Muktasana, Setu bandhasana or Shavasana are recommended.
So depression can affect the human mind at any point, like the chariot without a driver. But with a little attention and the love from the husband and family and a proper, Ayurvedic postnatal regimes, a mother can cope up with the postpartum depression at any cost and adapts to the new environment and gets free from the state of illness soon.